Hi, I'm Dr. Anne Marie, and thanks for joining us. Today we're discussing a medical breakthrough to treat bunions and joint pain in the big toe. We're fortunate to have world-renowned foot surgeons Dr. Michael E. Graham and Dr. TJ Ahn in the studio with us to take an in-depth look at this new innovative procedure. Doctors, thanks for being here.
My pleasure.
Honored to be here.
So before we start, bunions, what are they?
So bunions are enlarged big toe joint. So when they get enlarged, sometimes it irritates by the shoes or the way they walk.
Why are some folks basically cursed to develop these?
Yeah, you know, it's a hereditary thing that you're either going to have it or you're not. And they progressively get worse over time. So.
Why?
Yeah.
Why do they progressively get worse? Is there an underlying reason?
There has to be an underlying reason, exactly. And so, you know, walking is one of the most common conscious functions of our body. It's actually number 2 next to breathing. And so with every step that we take, there's actually a slight misalignment at the big toe joint that begins in the hind foot.
So what does that mean in the sense of, for our viewers, in the sense of the hind foot mobility, I should say, excessive mobility?
Exactly. So there's really a pathologic condition, meaning it's not normal, where the ankle bone loses its normal alignment and stability on the heel bone. And in orthopedics, we have this saying, it says that the hind foot controls the forefoot. So because of that excessive hind foot motion, then that puts a lot of strain on the big toe joint, and then the body reacts to that strain by forming spurs and thickening of the tissues, like Dr. Ahn was saying.
You know, a lot of people have bunion surgery, corrective surgery, and afterwards they either complain of pain. In some cases, the bunion comes back.
Exactly. There's been over 100 surgical procedures to try to fix bunions, and the leading complication of all of those is recurrence. So what that tells us is that the surgeon did perform a great job of realigning the bones and everything, but something was missed. There's a missing link to the treatment.
And that link is in the back and the heel.
Exactly.
We have these great models here. Do you want to demonstrate in the sense of this new procedure and basically how the hind foot controls the forefoot and what your solution was?
Sure, exactly. Well, let's first cut to the video that we can see. Here is an aligned ankle bone. So what we're looking at is a weight-bearing x-ray of somebody who's standing, and we see here's the ankle bone, here's the heel bone, and in between those two spaces, we have a naturally occurring space called the sinus tarsi. And now here's another patient that has a misaligned ankle bone, and you can see how the ankle bone is moving excessively and how that little space is closing. And then we can now take a look at the forefoot, and we see that here's the first metatarsal bone, and then when the hind foot kind of is misaligned, the metatarsal bone is jamming into the base of the big toe joint.
In my practice, when patient presents for bunion, and then when they stand up with full weight bearing, their bunion actually seems to get worse, and they don't know why, but usually because that hind foot misalignment causes more pressure to the big toe joint, and it makes bunion actually a lot worse than it is. So when we correct rear foot misalignment, surprisingly, a lot of times mild to moderate bunion kind of corrects itself.
It's kind of like the hind foot's connected to the forefoot, right?
Absolutely.
What are your thoughts about
Exactly.
orthotics? Because, I mean, in a sense of fixing bunions.
Well, again, this is one of those other big myths, and you know, orthotic industry is a billion-dollar industry. It's unregulated, and so many people recommend, so many doctors and everybody recommends the use of orthotics to slow or prevent your bunion from occurring. But the reality is very different. There's not a single published paper that shows that an orthotic reverses or slows bunion formation. Actually, there's 2 papers that shows how patients' bunions progressively got worse, and that's because orthotics don't realign and stabilize the ankle bone.
Sounds good. But
Yeah.
you do recommend maybe possibly even after the procedure, maybe having orthotics as an...
Sure, exactly. So how the best way to fix this is that we have this space that's closing abnormally in between the hind foot bones, and so we want to put a little stent into there, and so we have
it right here, right?
Yeah, exactly. So we have this little titanium round little spacer that is inserted into that little space just through a small incision, and instantly the ankle bone is realigned and stabilized. And as Dr. Ahn was saying, when patients are standing, it decreases the force on their big toe joint, and so we have many cases where the bunion actually reversed itself, or at least it didn't get progressively worse.
20-minute procedure, minimally invasive. People are back on their feet in a week or two.
Yep.
Sounds too good to be true, but how exciting. If folks want more information or find a doctor in their area that performed the procedure, is there a good website they could go to?
Absolutely. We have atlasfai.com. We have a whole network of surgeons throughout the country that have this available for their patients.
That's awesome. Doctors, thank you so much for being here. Great information.
Thank you.